My name is Katie Hoskins, and I'm going to inform you about OCD and the effects of OCD on people. OCD is a very hard disorder to live with, and it can affect every aspect of someone's life. Only a little more than 2% of people in the United States are diagnosed with OCD in their life. The way that OCD can manifest itself is as repetitive, unwanted, and intrusive thoughts and irrational, excessive urges to do certain actions, and it can be exhausting. OCD is much more than what the media may portray it to be. OCD affects every aspect of a person's life, and most people at some time in their life will experience some small OCD symptoms, but nothing like full-blown OCD. This could be something like checking to make sure the oven is off, or checking to make sure a door is locked. These small symptoms would never end up as a larger scale OCD symptom for most people. I was diagnosed with OCD when I was younger, and I've dealt with it for a few years and know a lot about the disorder. There are many different symptoms, treatments, and risk factors when it comes to OCD that I'm going to discuss. The term OCD is obsessive compulsive disorder. This means that with OCD, people will have obsessions and compulsions. Obsessions are repeated thoughts, urges, or mental images that can cause anxiety. This could be a fear of germs, unwanted thoughts, or aggressive thoughts towards oneself or others. Compulsions, on the other hand, are repetitive behaviors that someone with OCD may feel the urge to do. This could be excessive hand washing, cleaning, and checking on things. For example, making sure a door is locked many times, or making sure an oven is off even though they've checked many times. OCD is much more than just perfectionism, which is what a lot of people like to think OCD is. These obsessions and compulsions can easily control someone's life if it's not treated correctly. This disorder can cause interferences in the daily lives of people who have been diagnosed with OCD, and that is the main reason why a lot of people seek out treatment for OCD. These treatments can dilute the effects of OCD to make their life much easier, and all of these symptoms are from psychiatry.org. There is no cure for OCD, but treatments can make people's lives much easier. One main treatment that people use is psychotherapy. This type of therapy exposes a person to the cause of their anxieties so it can relieve some of them, and that is exposure and response therapy. Another type of therapy that works with OCD is cognitive behavioral therapy. This works with changing negative thoughts and behaviors that go along with their anxiety. If these do not work or sound appealing to someone with OCD, there are other steps that they can take. Another step is medication. It is widely used by many people with OCD. The main kind that people use and are prescribed are antidepressants. The main issue with this type of treatment is that they tend to take longer to work with OCD, and a lot of the times they must be used longer. Therapy should be used most of the time before medication because it actually gives people a way to deal with their anxieties and their obsessions and compulsions. And everything about the therapy and medication is from NAMI Metro. But now that we've talked about obsessions and compulsions and the treatments of OCD, what are the risk factors of OCD? There are three main risk factors when it comes to OCD. Two of the main ones are genetics and brain function. People who have a parent, sibling, or child with OCD are more likely to have OCD in themselves. Along with this, if a parent, sibling, or child develops OCD as a child or teenager, that person is more likely to develop OCD as well. Although there is more research being done about OCD and brain function, and not everything is known yet, there is some correlation between abnormalities in the brain and OCD diagnosis. The environment is also something that plays a part in OCD and its diagnosis and development. A lot of this information is still being researched, and we do not know everything about it yet. There has been research that says that people who have childhood trauma may develop OCD sometime in their life more than others. And there's also a lesser known condition that's still being researched called pandas that forms after a strep infection and also gives children symptoms of OCD. And all these risk factors are from the National Institute of Mental Health. OCD is characterized by harmful obsessions and compulsions. It can be a debilitating disorder, but if treated correctly, it can lessen someone's hardship in life. Although it's not completely common, most people know somebody with OCD or may have it themselves. So before judging somebody based on what they're doing that you may think is weird, think about how they may not be able to control it and how they're trying really hard.